Presentation of a preliminary study of the knowledge, attitude, and practices on epilepsy of our healthcare workers in Sierra Leone. The slide you can see is the center of Freetown, and there is the landmark, the most famous landmark called the Cotton Tree, which is over 500 years old. But still, I think the discrimination against people with epilepsy is even older than 500 years. Our epilepsy outreach courses, which we do around the country, we do sort of a composite class that comprises of doctors, community health officers. These are so-called clinical officers in some other countries, I think also clinical assistants in other countries. These are health workers that are trained to a level higher than a nurse, but less than a doctor. And we train the doctors, the CHOs, as well as nurses, all in one class. And it's because of this that we decided to look at the attitude, knowledge, and practices of these three groups that we train together to see if there are significant differences. So in fact, the aim of the study really was to assess the background knowledge of these healthcare workers on epilepsy to determine if there is significant difference in the basic knowledge among the various cadres, to determine any biases, conscious or unconscious, against people with epilepsy, and to use the information to improve training of healthcare workers. So for this study, we looked at hospitals and health centers in the western area of Sierra Leone. Sierra Leone, 5 geographical areas. The western area, where the capital Freetown is situated. We have the eastern province, the southern province, the northern province, and the northwestern province. We looked at all grades of nurses, the community health officers, as well as doctors. These doctors were mainly medical officers. These are doctors who were not in any postgraduate program. So we took 20 in each cadre, and generally these doctors and nurses and CHOs that we study are not routinely involved in the management of patients with epilepsy. So we wanted to see what their basic knowledge is. So we gave them a self-administered 24-item questionnaire that looked into demography, epilepsy care knowledge, source of knowledge, personal attitudes, including social tolerance, willingness to provide care, and their practices. There was a 100% response rate. 55% were males. Usually, mainly the doctors and the CHOs were more males, whilst the nurses were more females. The mean age was 35.5 years. The nurses were a little bit older, about 38 years. So we can see that these nurses and doctors have been trained for over 10 years. 31% have never treated someone with epilepsy. 6.7% have never known someone with epilepsy. 8.3%, mainly the nurses, believe that epilepsy is contagious, and 98% believe that epilepsy can be controlled. We looked at their sources of information on epilepsy, and as we can see from the slide, most of them got their information from formal lectures, usually while they were in school. But we also looked at continuing education and self-education, and we can see here that the doctors, 70% of them did have some degree of continuing self-education, mainly from print and electronic media and the internet. The CHOs have some amount of self-education and continuing education, but not so the nurses. And to look at their attitudes, we asked 3 questions: whether they've known someone with epilepsy, of which 93% of them said they had. And then we asked whether they will be willing for their children to interact with persons with epilepsy. And 95% of them said they will. And then we asked them if they will be willing to allow a relative to marry someone with epilepsy. And here, just over half of them said they will. I think when the study was done in Zambia, they did a lot better than we did. 75% of their population actually said that they would. But when you break this down into the three different categories, if you look at the doctors and the CHOs on the left side of your slide, you can see that they were very similar. 12 or 13 out of 20 in each group were willing to allow a relative to marry somebody with epilepsy. But when you look at the nurses, it was completely the opposite. Only 7 out of 20 would allow a family member to marry someone with epilepsy. And then we also wanted to look at their preference, their willingness to treat people with epilepsy. So we gave them a list of 10 common medical conditions that they're usually familiar with and asked them to rank the top 3 of those 10. And then we computed all their answers into this particular table. And what we see here is that epilepsy was at the bottom of the list next to mental illness. And only 1 out of the 60 participants ranked epilepsy as their first choice. And 2 of them ranked epilepsy as their third choice, and that was it. So epilepsy was not a popular condition that they would like to treat. And then we flipped the question round and asked them, what are the 3 least conditions that they would like to treat? And here again, we can see that epilepsy and mental illness are amongst the top of the conditions that they are less likely to treat. Then we wanted to know something about their knowledge or perception of causes of epilepsy. And as you can see from the table, head trauma, bath asphyxia were 2 of the commonest causes that most of them identified. But some of them also identified cerebral malaria, meningitis, febrile convulsion, and possible hereditary. But if you look at the last 2 sections there, demons and witchcraft, it was interesting that 3 nurses and 1 CHO actually believe that demons and witchcraft has something to do with the causes of epilepsy. And then we looked at their knowledge of the manifestations of epilepsy. Again, loss of consciousness, convulsion, tongue biting were all identified. Not so many of them actually identified incontinence, confusion, and staring. When it comes to staring, you could see that the doctors did better than the other 2. In fact, the doctors did better in identifying most of the manifestations of epilepsy compared to the other 2 categories of health workers. Now we looked at the emergency management of a seizure, of a convulsion. And we see that most of them would turn the patient on their side. Some of them would give oxygen if available. But the worrying part of this question was that almost 70% across all 3 categories said that they would place a hard padded object in the mouth of patients having a seizure. And then some of them, particularly the nurses, say they will hold the patient down. So that was something that needed to be addressed. And now we gave them 5 drugs and asked them if they could identify which ones are epileptic drugs. And I think they did reasonably well in terms of carbamazepine and phenobarbital and phenytoin. A few of them identified aminophylline and aspirin, but this was not common. Now, we wanted to know what their perception of what people with epilepsy can and cannot do. So we gave them a list of activities and asked them which activities they would ask people with epilepsy to avoid. And again, they did reasonably well on this one: drinking alcohol, swimming alone, driving a vehicle, cooking in open fire, working with dangerous machines, and climbing heights were all identified. And also None of them actually said people with epilepsy should not go to school, which is good. And only occasional of the participants actually said that people with epilepsy should not have a job or get married. I think in the Zambian study, up to 20% of their sample said that people with epilepsy shouldn't have a job or shouldn't get married. So in conclusion, the basic knowledge on epilepsy is inadequate among healthcare workers that are not directly involved in treating patients with epilepsy. Doctors had more knowledge and better practices than the CHOs, and nurses had the least. There is still bias against people with epilepsy among our healthcare workers. 8.3% of the healthcare workers, mainly nurses, believe that epilepsy is contagious. In general, however, healthcare workers can give reliable safety advice to people with epilepsy, and they believe that people with epilepsy should work and should marry. Emergency care during a seizure is suboptimal. The findings from this study have now been incorporated into our training programs for healthcare workers. I thank you very much.
Thank you very much, Professor Lisk, for this very interesting talk. Dr. Jacob, could we take some questions, or maybe we'll let the questions till the end?
Hi, Professor Najib. I was going to suggest if there are quick questions now, we could just take two, then we have the rest at the end.
Yeah. So maybe I could start with one question for Professor Lisk. So I'm very happy to see you with us, and you're welcome. And I think we have a good collaboration to develop in our continent for our patients with epilepsy. So I want to know in Sierra Leone if you have any collaboration with the Ministry of Health or Ministry of Social Affairs in your country, between your association and politicians, to assist patients with epilepsy.
Yes, in fact, all these workers that we are training, they are all employees of the Ministry of Health, and we train them in health facilities, Ministry of Health facilities, and the Ministry of Health has a focal person for epilepsy in the ministry, and also the person in charge of primary health care is closely associated with the epilepsy program in the country.
Oh, very interesting. And I want also to know if you have good collaboration between all the university hospitals in your country and I think the specialists. Is there any collaboration? Are there any societies or associations of specialists in collaboration with societies of patients?
Not directly, of course. I am associated with the university myself. As you can see, our emphasis really in our country and several countries like ours is to train more health workers that are not medical, that are not academic. We have put a lot of emphasis on nurses and community health officers because these are the people who man health centers far away from the capital, you know, in the districts. And so they come across more patients with epilepsy than we would see in our teaching hospitals and our epilepsy clinics in our teaching hospitals. So our emphasis is on a lower cadre of healthcare workers and try to make them efficient in dealing with people with epilepsy and to know when to refer for specialist services where these are available.
Thank you. Thank you, Professor Lisk, for your wonderful and detailed presentation. Thank you again. Thank you, everyone. Thank you. Thank you.